So our study looked at whether low socioeconomic status was associated with either advanced stage or aggressive prostate cancer in a population exclusively of African American men. And this study was based upon prior studies that have suggested that poverty is associated with either advanced stage or adverse prostate cancer. However, those studies were primarily performed in mixed race cohorts. And we know that there are strong associations between African American ethnicity and poverty, and so it was unclear whether the adverse prostate cancer was due to African American ethnicity, men who are known to be at an increased risk of advanced stage or aggressive prostate cancer, or socioeconomic status. So in order to eliminate that potential confounder, we looked at a population exclusively of African American men who were treated with radical prostatectomy at our institution between the years 2010 and 2015. From each man's residential zip code, we determined their median household income, and then we looked at markers of advanced stage disease or adverse pathology by median household income. So we took the men and we stratified them as either low income or high income relative to the median household income, and we found that the low income men had higher PSA levels at the time of diagnosis. They had higher rates of adverse pathology at the time of radical prostatectomy, including positive margin rates, rates of seminal vesicle invasion, and rates of extracapsular extension, and a higher overall disease risk as determined by the Capra-S score. So from these findings, we concluded that poverty is associated with an increased risk of adverse prostate cancer in a population exclusively of African American men. The reasons for this finding remain unclear. It's unclear whether this is decreased access to care, potentially dietary or environmental factors, or something about the stress of poverty that predisposes these men to higher risk prostate cancer. But certainly from these findings, it would suggest that these impoverished African American men may benefit from more intensive screening efforts or more aggressive diagnosis and treatment of localized prostate cancer.